Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Elizabeth Cleveland, and she's the Associate Director at the University of Arkansas for Partners for Inclusive Communities, and also an expert in leadership education and neurodevelopmental disabilities. Dr. Cleveland, thanks for being here.
Thank you for having me. It's a pleasure.
So tell us about this new program, some really exciting things happening.
There are very many exciting things happening for sure. Partners for Inclusive Communities has recently been given a grant from the Department of Human Services to expand preventative services in the state. So we're preventing crisis, specifically in the pediatric population. The part of the program that I am most involved with is one that prevents through identification. So we're expanding an interdisciplinary diagnostic model for neurodevelopmental disorders and like fetal alcohol spectrum disorders, autism spectrum disorders, that sort of thing.
So are you seeing that FASD is a need? It is a problem here. Education, training for physicians, or what does this really entail?
There is a need. It's highly prevalent. 1 in 20 individuals meets criteria for FASD, and yet less than 1% of them are getting diagnosed. There's also a need for just differential diagnosis of neurodevelopmental disorders worldwide, really, but certainly in Arkansas as well. And we're seeing that physicians and practitioners, allied health, mental health, people are really noticing that there is a gap in the services and a gap in that identification, and we're hoping to fill that gap through education and this particular project.
So what does education for this project look like?
Yeah, so for the part of the diagnostic expansion, the name that we're giving it is Comprehensive Screening and Assessment for Children, or CSAC. And I've developed a model with the team at Partners called the Statewide Practice of Interprofessional Clinical Evaluation. We love a good acronym, the SPICE model. And so that has 5 learning modules with it. The first 3 are really heavy in information and technical things. How do you look at symptoms? Where do they overlap in developmental disabilities? And then the 4th and 5th modules are very individualized for the practitioners and for the teams of practitioners. There's some mentoring and there's some one-on-one kind of problem solving. Where do you get your clinic team from? Who in the community do you partner with to do this model?
So is it a deep dive for, say, mostly like PCPs? Is that who the target is? Or what type of healthcare professional are you looking to participate?
Great question. Yes, PCPs, absolutely. We're want to participate in this. And we've gotten a lot of traction from that population for sure. The model utilizes some standardized testing too that PCPs just don't regularly do in their offices. So the idea is for a practitioner who has a business in a community to partner with another practitioner, a speech language pathologist, a psychologist, someone who does these standardized assessments on the regular basis, for them to come together to provide the diagnostic model for that community. And so they're not having, long wait lists, and their patients aren't having to travel long distances when they have to decide, do I feed my family or do I use the gas money to go, hundreds of miles? So we're hoping to build that capacity right there in the community.
So when does the project start? Are you recruiting physicians and healthcare professionals to be a part of this now?
Yes, the project has already started. We are recruiting now. And like I said, we've got a lot of traction, which is exciting. So if somebody wanted to participate in it, we would start them on the training modules so that they can get the knowledge that they need. They have the knowledge. It's just a matter of putting a specific lens on what they already know. And then we provide the assessment. We provide a kit of assessments for each team, so that interdisciplinary team, and we can get them started so that they can start seeing kids.
And so your staff is this Partners for Inclusive Communities really is the kind of at the backbone of kind of continuing the education and opening up questions, right?
Yes, that's exactly right. So Partners for Inclusive Communities is the University Center of Excellence in Developmental Disabilities for Arkansas. And we have 3 staff members over there, an APRN, a genetic counselor, and a speech language pathologist, who are all working together as essentially the expert team, the state-based expert team that anybody who participates in the SPICE program, in the CSAC program, can come to them and ask questions. They will be the ones to provide that mentorship that we were talking about earlier.
So if someone wants to participate, what is the process? Do they go to your website? I mean, what are you looking for?
There's a lot of different avenues that they could take. One would be to go to AFMC's website, because y'all are helping so much with the modules themselves and the training portion. They can certainly email our team, of our state level team, or they can go to our website, and there's our contact information, the Partners for Inclusive Communities website, and they can get to us through there too.
And what does the timeline look like? You want people enrolled or to participate by when? Or is this just ongoing?
It's kind of ongoing. The funding cycle ends in March 2025. So we are on a tight funding cycle stop point. However, the beauty of this model is that we can train people whenever they become interested in having that skill set. It's a specific skill set that takes the 5 modules of training to do. It doesn't have to be that they need to be enrolled by end of September or anything like that. So if they came to us in the middle of October, at the beginning of November, we would still have time to be able to teach them, to be able to provide that mentorship, and then get them utilizing the strategies.
So if they go through all the training, is it like a certification? Is it something that you could add to your resume or list of things that they're experts or knowledgeable in?
And so they definitely will get a certificate after participating in all of the learning modules. And depending on the profession, some professions can allow that certificate for like continuing education hours. And then, yes, that is absolutely something that they should be sharing, is that they are SPICE trained, so that other people will know either they can refer their patients to them in the community, or patients can go to them and know that they can get that service there.
And before we close, you mentioned FASD, and it really goes beyond just that, though, right? When you say neurodevelopmental things, I mean, this is pretty extensive of what they're going to learn.
It is. So we utilize some diagnostic methods from the DSM-5, the Diagnostic and Statistical Manual, 5th edition. And in there, they have a chapter on neurodevelopmental disorders, which covers a lot of the different disorders. And so our training is meant to rule everything out to come to a diagnostic decision. Some places will rule in certain disorders if you have symptoms of, let's say, diabetes, for example. We don't do diabetes for sure, but if you had symptoms, you might go to a diabetes specialist to make sure that you check all the boxes for that. In our method, we're looking at any of the boxes that potentially could be part of the diagnostic criteria and narrowing it down so we find the best fit to all of the symptoms together.
And this is the first time something like this has happened in Arkansas?
Yeah, there are some other diagnostic expansion things that have been going on. Cobalt is a great program, certainly, and some others that have happened over the years. This is the first of the differential diagnostic expansion in that big movement. So yes and no, but this is certainly unique. It's a unique perspective and a unique pathway to get that differential diagnostic model, and one that is not widely used in the United States. So we're pretty excited about the pilot that we're working toward.
Well, I'm excited too, and it sounds like it's something that could definitely have a long-term effect on Arkansans and children and families that can, for the better, they make a change for the better.
Absolutely, absolutely. You know, the research tells us that identification alone, just identifying, not the interventions, not what's next, just knowing that there's a brain-based disorder can lead to more success rates in the child and more patience and understanding from the environment around the child.
Well, thank you. Thank you for being here today and for talking about this exciting program. And I hope that not only do you have physicians and partners that are interested in participating, but that you see long-term effects of how this affects Arkansas for the rest of the time for how this can really make a change. Thank you.
Yeah, thank you. Thanks for the support that AFMC has given us too. It's an exciting thing, exciting to be part of it.
It is. Thank you so much.
Yeah.
Well, that's it for this episode of AFMC TV. Have a great day and thanks for watching.